It's been 5 years since I lost my brother. And I still see the same thing happening, people losing people because of the same problems with the dual diagnoses, with, you know, people with addictions and a mental illness, and I would just like to see a change. My name is Kristine. I cared for my brother who lived with a mental illness. This is my experience. I was a carer for my brother for 8 years. Very much loved community, loved talking with people. His boys loved to play musical instruments. He would drive them around to do gigs. Just a wonderful father that had time. When he wasn't well, he was not what society would call an easy person to have around. Back then, we were told that he didn't have an alcohol problem, that it was a mental illness by people that worked with, you know, in the drug and alcohol. And then in mental illness, they said it wasn't a mental illness, it was drug and alcohol. At one stage, my brother was really ill and had to have 3 operations because of an injury he'd caused to himself. He dropped some weights on himself and trying to make himself stronger because he was fearful of his life when he was out, and he would be drinking and roaming the streets and would get in arguments. And the nurse actually said to me, I'm not worried about his physical health, I'm more worried about his mental health. And yet he still left that hospital not being assessed. And the struggle is that we as carers know what's happening. We see it, we live it every day, and then when we're in a situation like a hospital, you know, in a hospital or a mental health facility, they don't listen. They don't hear us say they are not well, and they're actually not well enough to know that they're not well. On occasions we had the police come and they were always very apologetic, but no, we can't do anything. He doesn't want to come with us. I mean, sometimes he would be injured and wouldn't even get into an ambulance and wouldn't go to hospital because the fear of going to hospital as well. If you've got someone that's physically hurt and they won't get in an ambulance, they're frightened to go to hospital, what does that say to you? I would love to see GPs become part of an early intervention for people with a mental illness. That is where you go as a family, and if you see some changes in a loved one, that you can talk to your GP, and the GP actually knows a little bit about, okay, this, you know, this person, make it a little bit more friendlier than having to get someone to a mental health facility to be assessed. Make it easier so that you don't have to be on the phone 5 days in a row to ask the mental health assessment team if they will come out and assess someone. I want us as a society to get compassion back, to not look at someone and straight away assume that they're just woke up one morning and decided that I'm going to be an alcoholic, I'm going to be a drug addict. I guess I just don't want us to just assume all the time about people. I want us to look at them. I want us to have the time as a society to peel the layers back and then to fix those layers up, and then spend the time to actually put the layers back together and help make someone whole again and healthy.